I first started my career actually at Eli Lilly in pharma. But you have the opportunity to go into a pharmacy, into a grocery store, into Target, into Walmart, and you can look on the shelf and you go, I had something to do with that. I helped create that product. I helped bring that to market. And that's one of the things I absolutely love about consumer healthcare is you get the ability to see the fruits of your labor in a shorter period of time relative to some other career paths. It's also about being able to perform, having a level of performance that allows us to continue to reinvest in our business. And we are based in the UK now. The headquarters for GSK is in the UK. However, the global OTC and wellness R&D site for GSK Consumer Healthcare is in Richmond, Virginia, consolidating several of our sites around the world into Richmond. And so when you convert 9 billion British pounds into US dollars, it's about a $13 billion business, as I said, with about 20,000 employees, but about 300 or so roughly in Richmond and continuing to grow. Trust. That is absolutely essential in the healthcare space. And when we think about what our purpose is and what we need to deliver, not only into the marketplace, but what we need to deliver for consumers, it's about getting that balance right. And it's about giving back. And GSK Consumer Healthcare is involved with Smile Train. And we have actually helped fund 3,500 children who've received free cleft lip and palate surgery through our partnership with Smile Train. We continue to prioritize the delivery of our products that are in high demand during COVID-19, such as Panadol outside the United States, Emergency, Centrum inside the United States, Advil inside the United States. Next slide. So this is a picture of the Richmond site. So a picture is worth 1,000 words, and I know many of you obviously haven't had an opportunity to see the site, but this is an outside shot of the site. Where I'm sitting right now is the place where Will just wanted to get a job, which is in our flavor lab here in Richmond. So I decided not to sit in an office. I decided to sit in a space where we're actively creating products for consumers around the world. Next slide. So let's talk about, we've talked about who at a broad level, we talked a little bit about GSK Consumer Healthcare. Let's talk about Richmond briefly in a snapshot. So talked about how it's the #1 consumer healthcare company in the world, #1 OTC company in the US, #1 in many markets around the world, Western Europe, and major footprint in every continent around the world. We are a world-class site in Richmond with incredible capabilities, science and state-of-the-art technology. So you saw a little bit of that in the video, so I won't go back over that in the video, but if you take what the science and technology capabilities are within the consumer healthcare space, and we've had folks outside of the company come through here and look, this is really a crown jewel. We have more under one roof in this space to essentially go from what we call concept to consumer, keeping the consumer first, engaging consumers in our consumer home through the development of the products based on those insights to the launch of those products, and having the underlying science, technology, and platforms to do that enable us to be successful. And clearly with the brands I've talked about, we've been able to continue to grow the organization, grow the business, reinvest in Richmond, because we've had that kind of success for the good of the consumers, because the consumers are at the heart of everything we do. It's core to the decisions that we make. It's core to our values and our purpose, with how do we understand the consumer, and then how do we deliver on needs that are unmet within the marketplace for consumers. One thing I'm very proud about at Richmond is collaboration and teamwork, and I think very large companies. GSK as a company is about 100,000 people. Consumer healthcare as a company is about 21,000 people. Richmond is somewhere around, will be in the mid 300s. One of the things that I love about the Richmond site is it has a microculture. It really is about how teams come together and work collaboratively. It's almost like, forget the big company for a second. It's about how this team operates in Richmond, and the proof is in the data. The site has won a Best Workplace Award previously, and we continue to try and drive that culture even in the midst of a joint venture and acquisition, but we continue to try and drive that culture and connect people, because number one to our success is our success through people. Next slide. So what are some of those areas in Richmond? So it's pretty diverse, and as I said earlier, it really goes from what we call from concept to consumer. So our scientists are involved with focus groups. They're involved with studies that happen in a consumer home. As you may have or may not have noticed in the video, there's a simulated consumer home that is within the R&D facility where we're able to observe consumers. Imagine, if you will, the TV show Big Brother. And if you think about that TV show Big Brother, how you're able to observe, that's what we're able to do in a real home-like environment in the Richmond site. And you take that and you pick up on clues, and you develop insights around how consumers behave, how they interact with products, that informs how you develop those products, including with flavor technology, screening panels, our ability to design new and unique packaging, our ability to design new dosage forms that consumers will love and enjoy, but backed up by the science around characterizing our products, the chemistry, the microbiology, the analytical sciences that are absolutely critical for us to characterize and develop quality products that actually deliver for the consumer what we say it will deliver for the consumer. And then, of course, quality and how we manage quality into our products through the development process. And then finally, our ability also to develop and provide clinical supplies to any part of the world in order to test our products in a clinical setting or a consumer preference study. All right, next slide. And while all that's important, I firmly believe that we have to give back to the community. I firmly believe in inclusion and diversity. As a matter of fact, I have just recently been appointed the chairman this year of the U.S. Consumer Healthcare Diversity Council, Inclusion and Diversity Council, which I feel very privileged to lead. My career has had a long time focus in diversity. As a Black male, I've often been the only one in the room. And I would love to see that change over time. And I think as we've looked at where our focus is in Richmond and our commitment, it's been in two places. It's been in the community, which broadly impacts many of us. It's been around employee resource groups, and those are diversity focused groups. So Women's Leadership Initiative, Mosaic as a diversity group, which is Black and African American, Fusion, Asian Business Network, the Hispanic chapter, and VIP, which is a veterans group in Richmond. And all of those groups are very active. They're funded. We support them, and we encourage them to help our colleagues develop either in leadership or develop talent and reach out to the community. And part of how we do that and leverage into the community is through those employee resource groups. But as we think about our partnerships in the community, it's also around just giving back to the community. So for example, Massey Cancer Center at VCU. We have several members of our team who teach courses at VCU, industrial academic partnerships, the food bank, Mayor's Youth Academy, where we brought disadvantaged youth into the site for summer internships. Habitat for Humanity, the Children's Hospital Door Neighbor, Future Young Leaders, middle school girls, where you have an opportunity to mentor and be a part of their development, because it starts so early in terms of being able to influence. Crossover Ministry, several of our pharmacists have volunteered there, which is essentially a free clinic in terms of medication distribution. Our trade associations, Virginia ACS, Virginia Bio, it's a very active team. What the beauty of that, though, what I love about our focus here, it is colleague driven. It didn't come out of some leadership mandate, but it's about harnessing those things that people are passionate about, that want to contribute to, and want to get involved in. And we encourage our colleagues to do that at our Richmond site, because for us, this is part of our responsibility as an organization to engage, to help build the communities in which we live and the consumers we serve. And then lastly, political involvement. The past two governor's races of Virginia, we have hosted sessions here. Most recently, we were telling the self-care story with Governor Northam, who was here during his run. We host both candidates. So the goal here is to hear the positions of candidates, to influence them and tell them the self-care story, but at the same time, what we want to do is raise the awareness of the importance of our site and the importance of the consumer healthcare business to the everyday health of consumers around the world. So with that, I'll turn it back over to Will.
So before I let you go, I'd like to ask a couple of questions so that the candidates and the folks on the call can get to know you a little bit better. So quickly, where are you from originally?
So I am from Indianapolis, Indiana, originally. So I went to Broad Ripple High School, the same high school as David Letterman, but thankfully a few years separate us.
So another question I like to ask, just to give candidates different perspectives from different team members, and that question is, what is it for you that makes GlaxoSmithKline a great place to work for you personally?
Yeah, so great question. I think for me, it is really the focus on doing good for people. Honestly, I think one of the, it's interesting. So being a senior leader in the company, to hear the conversations in senior leadership meetings, which frankly are closed door meetings, and it coming back to, is this right for consumers? How do we continue to improve the quality of life of consumers around the world? That's the first lens. And I must say, when you work for a company that seems to be centered on purpose, for me, that's what's most important.
And one last question that'll just give folks some context. Can you speak to a typical day in the life for you yourself in your role at the company?
Well, that's a great one. So by virtue of my role, I spend a lot of time in meetings, but prior to COVID-19, one of the things I loved about my role is I traveled quite a bit. So I would spend a lot of time in Richmond and in New Jersey and in countries outside the United States. That ability to learn and understand those cultures, and the ability to there's something very educational about interacting outside of your own sort of microcosm or outside your own culture. And so for me, a typical week would be spend some time in Richmond, spend some time in New Jersey. I might be in South America, I might be in the UK, but all of it was around the purpose of bringing those new products to life for consumers. So
excellent. Well, we appreciate you taking the time out experiences to give us sort of an overview and keynote for GSK there in Richmond. So thank you. And without further ado, Unless you had anything else, we'll go ahead and introduce our next speaker. So our next speaker is Dr. Denise Walters. So Dr. Denise, if you are ready to present not only yourself and what you do, but also available opportunities.
Sure. I'm really happy to be here, excited to meet all of you. And my name, of course, is Denise Walters. I'm a team lead in the Global Analytical Sciences unit. I have been with the company for 21 years now, and that's not counting my first experience at the Richmond site, which was as a student before I went to graduate school. I got my BS in chemistry from VCU, and then I got my Ph.D. in pharmacy from VCU as well. And I got to spend some time doing organic synthesis in some of the time in between. So I have long ties to the Richmond site, and I absolutely love it. Just to let you guys know, even though I didn't go to a historically Black college, I really stand on the shoulders of generations of family members who did. Going back to my great-great-grandfather who went to Johnson C. Smith and graduated in, I think, 1876. And I have a number of aunts, uncles, cousins, grandparents who went to Virginia Union University. My dad taught at Virginia Union University, and both of my parents attended Virginia State University and got their degrees there. And in fact, my grandfather was a gubernatorial appointee to the Board of Visitors at Virginia State. He was the rector and even wrote a book, may not be able to see it well, but about the history of Black college at the crossroads. So that's been a real opportunity. Also, I wanted to let you know that I have chaired the local Virginia section of the American Chemical Society. And one of the things I got the opportunity to do there was really to help refurbish the Minority Affairs Committee. They were actually talking about canceling it at the time because nobody was really interested or driving it. And I found a really dedicated group of people, some at a couple of local colleges, VCU and Virginia Union, but also some folks from right at our GSK site who were willing to help lead the way. And we went from almost canceling to a award-winning section from the national office. So that was really exciting. Another thing that's really great about our site is we allow people to be their whole selves, everything that you are. And I am very proud to be an Afro-Indigenous woman, and I also honor and respect my Native American heritage, and I serve on the Tribal Council for the Nottoway Indian Tribe of Virginia. And then the last thing I was going to mention about myself is Peter talked about some of the things that we do in the community. And I do have a gubernatorial appointment myself to the Science Museum of Virginia board. And it's been really exciting to see the different things that they do to support diversity in the community. One of them recently being the article that they did on their heat map studies, showing that the heat maps exactly merit the red line districts. And they're now working with the community to put in various different green spaces to actually address that. So it's nice to be able to be part of things in the community that are creating action that makes a difference. Next slide, please. So Peter talked about the Global Product Testing Group, and Analytical Sciences sits within that. And this is where a lot of that groundbreaking science goes on that Peter talked about. We have a center of excellence in separation sciences. And I'm not going to go through and explain all of these acronyms, but for the folks who are on the call who are chemists, we have HPLC and a number of other different similar separation sciences. We have multiple different ways of detecting the signal, and we try and get most state-of-the-art equipment that we can. So sometimes we are actually trying something out that's brand new that the vendors just came out with this year. We might even be kind of a test site for it and the first ones to use it. So it's really great to be in a place where we can do that. We do a lot with the metal analysis, and I have the ICP, OES, and ICP MS listed there. Forgot to list that we also have ion chromatography, which can also be used for metal analysis. And one of the things that you probably noticed in that video is there was a discussion about automation, and automation is really important for us. One of the things that Peter talked about is we have only 300 people at our site, but we get a huge amount of work done. And one of the ways in the analytical group that we get a lot done is by having automated systems that will allow the scientist to develop a method, put everything on the instrument, and then the instrument is doing more of the sample preparation work so that the scientist can focus more on doing other projects and can get 2 or 3 things going at one time. And again, we also have really advanced problem solving. The scientists that we have at our site are not just routine people who test something and that's it, and they follow a set procedure. We're the ones who develop those methods. We're the ones who do the groundbreaking work to understand and characterize the raw materials, the finished products. Are they degrading? Are they stable? Are we giving the public the products that are the quality that they need? And that's one of the things I love about working here, is that I know if I take a product that we worked on, it's a high quality product. I don't have to worry about whether some of those things that you see in the media about adulteration are an issue, because we test our products and we know what we're doing. And I love working here because of that. Next slide. A little bit about the opportunities that we have at our site. We have a host of different opportunities. These change because, of course, we are in an open hiring state right now. So if you see it up here, but you don't see it on the page, it may be that we've already filled it, or it may be that we're about to post something. We do update those pages daily. So you'll get some more information at the end talking about how to go online and look for these jobs, but I'll tell you just a little bit about them. We have a entry-level BS chemistry position, which is the analytical associate scientist. That one is really basic skills. A separation science focus is what we're looking for. You would do some data interpretation, but you're really having somebody else do more of the helping you through, leading you every day. The next level up is an analytical scientist with a master's in analytical chemistry and 5 years of experience, or maybe a BS with about 7 years. This role requires a stronger separation science, more independent thought development, being able to work day to day and figure things out on your own. Then we go to our analytical senior scientist. This is really someone who's a technical expert. These are the folks that we would expect to be figuring out the degradation products and the synthesis and really solving some of those hard technical questions that are really PhD level research. And that level does require either a PhD in analytical chemistry or a master's with at least 7, or a BS with maybe 10, depending again on what your skill sets are and your experience. We also have a couple of planner positions, and in those we still need advanced laboratory skills because you would have responsibilities in the laboratory, but those roles will be a little bit more data interpretation, some troubleshooting, and doing more of the day-to-day planning. How are we going to figure out how to get this done? We've got multiple studies initiating at the same time and only so many people. What's the best way to get this done efficiently? So that's the summary of my roles, and I will turn it back over to you, Will.
So, I'm not going to let you go without asking you a couple of questions.
Absolutely.
So tell us a little bit about, your favorite, what you like most about working for GSK.
What I like most is that GSK really supports colleague development. And Peter is one of the people I really appreciate, because years and years ago, he recommended me for a women's leadership class, and I found it transformational. And I went from not really being as career focused as I probably should have been to getting those leadership positions that I talked about, like the Science Museum Board and the ACS Board, and being able to make a difference in the community. And I don't know that I would have even thought about doing those if Peter had not put me in a position where I had the leadership training and the opportunities to think out of the box and approach things differently.
And then what is a typical day in the life for you now? And I'm kind of curious with your background in chemistry, correct? I'm kind of
Yes.
curious, sort of maybe your career, different things you've done in your career, having that educational background to what you do today.
Okay, sure. So my educational background was some of everything. I got my BS in chemistry first. I did some work with organic synthesis, again, when it was H. Robbins, but in the same building as now. And then I also worked for a little company that did asbestos testing. Then after that, I got my PhD in pharmacy, and I worked for a little company called Whitby, and that was small company, so I did everything soup to nuts almost there. There was one project where I uh, made a prototype. I tested it in the analytical lab to make sure it was made correctly. I shipped it out and flew down to a site and watched them dose animals with it. And then I came back, I took the blood and I analyzed all the blood. I did the pharmacokinetic modeling, I wrote the report. And it was really exciting to see years and years later that that product actually was on the shelf somewhere, even
Wow.
though it went through multiple different companies. Then I went to work for a not-for-profit research institute, and that was about 50% government study and then 50% uh, pharmaceutical companies. And worked there for about 5 years until I finally ended up coming to Whitehall Robbins, which then became Pfizer, which then became GSK.
Okay.
So that's been my career journey, and I think all of those were all hands-on bench positions, and until about 2013, which is when I made the transition to management. And I think all of the experience that I gained in those various different positions that I had in the laboratory really prepared me for management, because about half of the job is being able to help people with solving technical problems, and the other half the job is basically helping people. It's working with them in the HR and helping to develop them and helping them to achieve their goals while you're also achieving the company's goals.
Excellent. So I really appreciate you taking the time out to share your experiences with our candidates. But without further ado, I'll go ahead and introduce our next speaker. So our next speaker is Dr. Kamala Chapman. So Dr. Kamala, I'm sorry, just Dr. Kamala Chapman.
Kamala.
So if you're ready, I'll go ahead and pass control over to you.
So hi, welcome and thank you guys for joining. My name is Kamala Chapman. I am Director of Wellness and Lip Care for the United States, focusing on emergency and chapstick. So a little bit of background about myself. I'm supporting the product design and formulation. So that's what I'm going to talk about today. Peter touched on it earlier. I have been a member of GSK, Pfizer, then Wyeth for 14 years. And I have had the blessing of working in the same building my entire career. So I left undergrad and I started working at Wyeth at that time when I was 21. So I've been there. I'm telling you guys how old I am, but I've been there from 14 years. So I am a member of the Consumer Healthcare Inclusion and Diversity Council, in which we focus on, it's a new council that has been made. We really focus on moving the diversity agenda within consumer healthcare for GlaxoSmithKline. Also focused on retention, retaining, and making just the building and our division a better place for all. I'm an active member of Alpha Kappa Alpha Sorority Incorporated. I crossed as undergraduate Boulé through Lambda Chi at James Madison University, but I was actually I actually went to Mary Baldwin University. So it was, if anybody is Greek, it was a very interesting experience to actually cross at a different school and as an undergrad. I am also a site lead, co-lead for Mosaic, and Peter also mentioned that, and that is our employee resource group. It is our African American employee resource group, but we also are open to everyone. So it's anyone who has a desire for diversity and understands the plight of the African American experience can come and join Mosaic and learn about our culture and contribute to our site. So next slide. All right, so I'm going to talk a little bit about the formulation development opportunities that you would see on the website if you actually go in and look. So this is under, as Peter was speaking about, global product design and development. So in that, we have product design, flavor technology. Will, if you want to come work with us, just let us know. Process development and package and design innovation. So I'm just going to kind of focus a little bit about the formulation development opportunities. That's where we have the biggest need in that bucket. So we have these in multiple areas covering a variety of different dosage forms. So in the video you may have already seen, we work on a lot of different forms. So when you go to the store and you pick up a tablet or you pick up any type of product, there's a lot of science behind that. So we work in tablets, capsules, confections such as gummies, chewables, things that you enjoy, suspensions like Robitussin, or Theraflu, like something you would take when you're sick that you shake up and you take like a liquid. Beverages, creams, cosmetics, and powders. And when I say powders, think emergency powder that everybody's loving to take right now. So keep taking it. It requires a flair for creativity with a solid scientific background. And the reason I say a flair for creativity is because these products are products that you want people to choose to take, right? So these are not products that a doctor is writing you a prescription for. So that's why flavor is important. Creativity is important. Understanding what people like and don't like and what drives them to purchase is important. Taking all of that and marrying it into a product that goes on the shelf and makes everything kind of pop and makes people pick your product versus someone else's that is similar or a competitor. So that requires a connection of consumer feedback. So you saw the video and you saw our Big Brother room, and we have a lot of other ways that we can connect this feedback. And we take that feedback and someone says, I like blue and I like apple and I like this, and we move that into our next formula and we move those flavors into our next formula. It involves a lot of interface. So you need to be able, for these type of jobs, not only to be able to make those connections, but to be able to vocalize, what you feel is going on, what's best for the product with multiple groups. So you're not only going to be talking to people in R&D, you're not only going to be talking to scientists, you're going to be talking to folks in marketing to get the R&D agenda pushed across. You're also going to be talking to people maybe at different manufacturing sites. So you'll have to be able to change and tailor your communication style based on who you're speaking to, with ultimately the R&D agenda at the bottom. And it does require travel when COVID lifts to various manufacturing sites to help move forward and scale up your product. So we have a lot of manufacturing sites all throughout the world. And so just because a lot of the jobs you may see are US based, they're all US based, but the products may be products that are sold in the EU. They may be products that are sold in Asia Pac. They may be products that are manufactured in EU or manufactured in the US. So there's a lot of requirement for travel when the time comes. So next slide. So here are some of the available opportunities in product design. So you can see that when you look, so you're not confused, we have regions. And so you'll see the word America, wider Americas, or EMEA, which is just another, the Europe, Middle East, Africa area. So you'll see regions that are kind of posted. And then you'll also see categories that are posted, meaning a wellness category is similar to a vitamin or a mineral. And respiratory and skin, you would see that as a category, meaning respiratory, anything that is respiratory related, like Theraflu, Otriven. And then you'll see something that says pain, which are some of our pain brands like Panadol and Voltaren. So when you see that, just realize that some of them are regional based, and you'll be focused on products that are for certain regions, like where my team is a Americas region. We don't focus on wider Americas or EMEA, but then you'll see some that are category related, and you'll see postings that are really specific to the brand, right? So you'll see Otriven, Theraflu, Panadol, or wellness category, just so that you're clear on what you're seeing. Next slide. Okay, so I'll also talk a little bit about Scale Up as well. I don't work in the Scale Up organization, but what Scale Up is so after we finish our role as R&D scientists or formulation scientists, and I was speaking to you about travel to manufacturing site. Once you get to that point, there's a partner organization that comes in, our partner team that comes in and helps push it all the way through commercialization. And many of these, if not all of these jobs are engineering positions, right? And you can understand that because positions that are going to be focused and working with a lot of the manufacturing train, right? A lot of the large equipment. So you're moving from something this small to something that's huge, and making sure that our product scales up nicely. So you'll see some of these, these really do require, a background in engineering. What I didn't mention on the previous slides is that those positions, we're looking for a chemistry background, biology background, science background, engineering, food science. Those backgrounds are more than welcome to apply for those positions in formulation development. But for these scale-up opportunities, a background in engineering is desired, or even if you don't have a bachelor's degree in engineering, maybe just that you've worked in an engineering capacity, that is definitely preferred. So you'll see the opportunities are very concise. You'll see process engineer, senior process engineer, principal process engineer, or you'll see a team lead role. And you can read there. So the process engineer is the entry level with 2 years, the senior process engineer 5+, and then principal process engineer 7+ years. And we really at that point look for someone with a lot of experience in scale up and manufacturing of dietary supplements or OTC drug products. So I think that may be my last slide. Well, I'm not sure. Oh, stewardship, sorry. There's one more after that. So the stewardship opportunity, that falls within the same group as the scale up group. And so what that role is that once we actually commercialize a product, the stewardship group watches and makes sure the product is good for a period of time. And so sometimes we have formulas that we change, shortly after launch, or we have commercialized formulas that we come back and bring in. Maybe we want to change a flavor, or we're changing an ingredient or something like that. That is where the stewardship roles come in. And so we do have roles there for senior development scientists and formulation development scientists. And this is kind of like the best of both worlds, because you're a formulator and you're kind of also doing a little bit of scale up work too, because this is commercialized product. And so for this, you need to be able to formulate, obviously, for drug products and dietary supplements. And there are a lot of vacancies here as well. And if you have a background in engineering here, again, would be a really good thing to have as well.
So I've got one question for you before I let you go.
Okay.
That question for you would be, for you personally, what is it that you like most about working at GSK?
So, it's a great place to work. And I mean, you're going to hear this over and over again, but, I can't emphasize how rare it is to start someplace and still be there, right? And it's a great area. Richmond's a great place. It's not too large, it's not too small. But also when you go into work every day, you feel empowered and able to do your work and do it well. You're surrounded by people who will help you. You don't have to know everything. It is a family. And we pride ourselves in being that. There's no one that knows everything, but there's always someone who can be there to help you, and that's what makes it great. And when you go to the store and you see a product that you've worked on the shelf, there's nothing better than seeing that as well.
Nice. Hey, so thank you for taking the time out to present what it is that you do there and some of the opportunities that you have available. But without further ado, I'm going to go ahead and move right along to our next speaker. So Jason Brooks, if you're ready. Jason is the project manager over respiratory and skin health.
Yeah, thanks, Will. I appreciate it. Good evening, everybody. So hi, my name is Jason Brooks, as Will has already mentioned. I'm a project manager. I'm at GSK. I've been with the company between GSK and Pfizer around roughly just over 3 years now. My background is in supply chain, to be honest. I started way on the other side of the business where I was managing some of our biggest vendors, partners, and making sure that we got our products to them in a timely fashion and making sure that we got products on the shelves, as everybody has talked about this evening. I didn't graduate from an HBCU. However, I did grow up in the HBCU community, somewhat similar to Denise. My mother taught at Livingstone College for over 35 years, graduated from the Morehouse School of Medicine. Both my mother and father are undergrads from Hampton University. My aunt, my godmother, they're all, they were worked over in the HR department of at Clark Atlanta University. So if you ever stood in line for financial aid, I'm pretty sure you've seen my aunt at some point in time walking through those halls. I'm an active member of Mosaic. I'm also a part of the Habitat of Humanity. I've actually just accepted a role as the treasurer of Toastmasters here in the Richmond site, and I'm an active member in the APICS. And if you don't know what APICS is, that's certifications around the supply chain community. Next slide for me, Will. So real quick, project management is what you think it is, but here at GSK, it's a little different in that it's a global project management role that I'm in. My boss actually sits in Nyon, Switzerland. She does not sit in the Richmond site. So with that being said, my days start very early, somewhere around 6 o'clock in the morning. I'm on meetings and conference calls. And that is really the testament to what Peter was talking about and how we are such a global organization. And then really managing that end-to-end process. So my role is much less glamorous than Denise's and Kamala's, right? I'm the one that has to make sure that what they're working on gets on the shelves, making sure that it is produced in the correct fashion. It meets GSK standards. We're presenting the best product out to the consumer and making sure that once we put our name on it, that it's something that we can stand behind. One thing I will tell you that I've learned working in this role here recently is that you touch a little bit of everything. You touch a little bit of everyone. And it's not just me working in a silo. I have to depend on my R&D person who actually sits in the UK. I have to depend on another one of my team members who sits in Warren, New Jersey. So it's not just me sitting in Richmond currently trying to figure it out by myself. It's definitely a cross-functional team, and it's definitely reaching many different facets in many different ways. Another thing about the project management role that I'm learning and I'm coming accustomed to is that you're really going to take a deep dive into what the product is that we're trying to put on the market. It's not something that that we take lightly, what we take for granted. We definitely want to make sure that what we're putting out there and what we're putting our name on is something that has meaning. And definitely when you use that product, we want to take pride in that product being in your hands. Not much more than that. I mean, project management is something that I take pride in that I get a chance to see this little bit of formulas and things of that nature turn into a product that then is tested amongst consumers, that I get to see reactions and get feedback from, that then gets packaged into our packages, that then makes it to the shelves. And so, and to Kamala and I think Denise both said, to see that process happen and to be on the opposite end of that, it's something great. I'll be remiss to say that my background in supply chain didn't help me. It did. I've worked in all facets, though. I'm not just in pharmaceuticals or healthcare. I've done everything from retail. So if any of you are old school like I am, Circuit City, that was when my career started in inventory management. I moved from there. If any of you have wood floors in your house, if you've ever been to lumber liquidators, I've also worked for them. I've done a demand planning and source wood from Japan, Russia, and Brazil. And if you've ever been inside of a doctor's office and you've seen a MetaChoice glove or something of that nature, I also worked at Owens & Minor, and I will help upstart their private label brand. So the breadth of knowledge and the breadth of experience that I've had, it's vast. I've also worked for the Marine Corps Exchange, making sure that the troops and the troops' families were kept comfortable and were welcomed with open arms when they got to the bases. I managed all of the exchanges for the Army. So my breadth of knowledge helped me definitely in this aspect. The one thing I can tell you that sets GSK apart in my mind is that, you know, Kamala said it is a family. From the day that I started, the first year in, I think Kamala was at my desk trying to get me to join Mosaic. She definitely invited me to meetings, sitting downstairs, you know, listening to Peter give us updates and things of that nature. Denise would definitely, if she noticed your face and it was new, she would definitely come over, shake your hand and say, so what do you want to do? How do you want to be ingratiated into the GSK family? And I think that that's something that you don't get everywhere. I can honestly say that. I've been able to just set a meeting on Victor's calendar and just go sit with him for about 45 minutes and just pick his brain. You know, he's been with GSK, he's been with Wife, he's been with a lot of different companies, and just understanding, you know, what is this all about and what does this mean to him and how can I navigate my career? Because everybody's looking for, you know, the longevity and really feeling like you're a part of not only a team, but a family. So I would definitely echo those sentiments. And really quick, next slide for me, Will. Just really quickly, you know, these are just some of the qualifications, but I will tell you, experience is the best qualification. So if you're able to have the experience behind you and you know what you're talking about, you're able to look at processes and end-to-end processes, and you're a type of person who likes to work in a team environment, but still being able to hold your own, being able to work cross-functionally and actually be able to talk to senior leadership and even somebody as your peer, or even someone below you, but everybody coming together as a team to make one product, one project happen from concept to launch. I think you'd be a great fit. As far as opportunities, I would just say go on the site, put yourself in the pool. We're always evolving those roles. Those roles change daily, change on an hour even. So just put yourself in the pool, and you know, if you want to get the best experience, I would say GSK is one of the best places to work. And that's all I really have. Where mine is less glamorous. I don't have a bunch of formulas and things to show you. You know, I'm just a guy who makes sure that the product gets to where it needs to go.
That's excellent. So how did you end up at GSK?
Really what happened was there was some friends of mine who worked at then Pfizer that I used to work with back at Circuit City. And I was looking for a new opportunity. You know, really, I had gotten out of healthcare. I ended up in the tobacco industry, and it really wasn't my knack. And I was really looking forward trying to get back into the pharmaceutical side of things. And, you know, they reached out, they had an open, an order to cash role for me. So I came in as an order to cash analyst. And so came over, interviewed, and the rest is history.
Excellent. Well, we really appreciate you sharing your experiences and sharing your insight. But yeah, so stay with us because we're going to have a panel discussion. But I'm going to go ahead and move to our next speaker, if that's okay. All right, so our next speaker is Victor Perez, R&D Business Development Senior Quality Manager. So Victor, if you're ready.
So how you guys doing? No, they did not leave the best for last. I just happened to be last on the deck. But like Peter, I'm pretty shy guy, right? I really am very quiet, but I thrive when I'm in a group of people because that's when I feel like I feel the most comfortable, and my excitement is always about highlighting everybody else's strengths. So I never feel intimidated by the experts that we have usually around me. The one thing that I want to say in terms of my background is a very unusual background because I went to, you know, when people ask me where you're from, I usually don't know what to answer. I'm originally from Brooklyn, but my parents were from Puerto Rico, and I kept going back and forth. And then I ended up in Buffalo for college, got married, had kids, ended up working there and staying there for 15 years. So I'm usually like to say that I'm a little bit from everywhere, but certainly I think that has played a role in my ability to work in this company. I went to high school at the same high school that the crime boss, John Gotti, went to. I hope that doesn't say much, but it also is the same high school where they film Spider-Man Homecoming. But it was very interesting because that was a place where they try to integrate people from different places. Brooklyn had been a place that was very segregated. New York City, had different pockets where different people live, and that was a center where they try to combine people from different backgrounds and different religions from everywhere. And so to me, it was fertile ground in what laid ahead. And so when I went to school for industrial technology. And so I say this because I want to speak to the people here that are looking at this information and say, well, this is great. I look at my resume and it doesn't really correlate with some of the openings that you have there. Well, my path was really, industrial technology was supposed to be a degree where they try to prune like engineers to be people managers, because engineers are very quiet, they're very into themselves, and they're trying to gather managers that can actually lead and understand the technical pieces. And so my first job was with General Mills in quality assurance. Very unusual. I was supposed to be in manufacturing, leading the charge of manufacturing processes. And from there, I ended up in the testing laboratory, just testing raw materials, wet chemistry. And so it's not what I expected. And I felt a little bit disappointed, but as I got to expand my knowledge, I got to grow. I had to really learn different technologies that I wasn't really comfortable with. And it became a career for me. And from quality control, I ended up going into quality assurance, which is a very different. And for me, I've been doing that for over 29 years, 19 of those years with YF, Pfizer, and now GSK. I do know Spanish very fluent, and I belong to the Perez Hispanic chapter. And I really love really speaking with people, being around people, and also partnering with the local communities to help them in whatever they need. I am very active in my church, again, for the same reasons, because for me, the excitement is not about what I can do, but also it's more about getting others to do what they didn't realize that they could do. So I like to take the person that's very quiet and put them in the spotlight. And for me, when they go out there and speak and develop and grow, I feel really excited about that. And I feel that at GSK in Richmond that I can really grow and do that. Next slide. And with that in mind, October 3, we actually had an event 2 minutes from the site, Diversity Richmond, and an opportunity came where we could partner with them and actually feed the community and give them some groceries. And the idea was to feed 500 people. And actually that's what happened. We went to the site, and the site lead was very cooperative and very quickly was able to donate product and donate the attire that we had, so that we were well represented in the community. And we partnered with the other ERGs to actually demonstrate to them that we're here to help, and we're here as part of the community. And to me, it was a very exciting opportunity because I was able to bring my family to also support the local community, and GSK was, of course, very delighted that we can participate. I think we have the next slide, additional pictures of some of the products and that we were able to donate, along with the food, along with some of the participants that were there with us. Next slide. In terms of what I do, I did say that I was in industrial technology, more of engineering, and I took a strange path into quality. I've been a people manager and also an individual contributor. Quality at GSK, also in Pfizer and YF, is very complicated because we have quality in R&D, we have quality in the commercial group, and we have a center group that manages certain functions within quality. In terms of what we do in R&D, we not only develop new products, but we also enhance line extension, what we call line extensions. We take existing products and make them even better. But to do that, we have to leverage our network, and our network might be comprised of not only our internal companies that make products, but also external partners that we partner with to actually make those products. And for me, I work with those contractors that will make those products for us and take those new businesses and those new opportunities, which may include not only developing new products, but also buying existing brands and also transferring brands from either our internal sites into our network of external partners. So a lot of what I do pre-COVID was a lot of traveling. Post-COVID and during COVID, what we're doing is a lot of this business through Zoom meetings and actually virtual tours on our contractor sites to make sure that we understand what they can deliver. And so I work a lot in the left column that you see there. And of course, right once we try to hand over to the commercial quality group, which is a group that we align with for the oversight of the contractor, they actually work with us in partnership to make sure that everything goes smoothly from design all the way up to launch, all the way up to management of key quality processes. I will say, I don't say this lightly, that when I go to the grocery store or pharmacy and I look at products, I really pay attention to brands because I know what goes into them. And I know that when I'm picking up a product like Advil, Sensodyne, or any of our brands, I know that a lot went into that, and it wasn't really something that we just let our contractors make, but we were there to make sure that it was done right. And so part of our process that you see at the top involves looking at our contractors on paper, making sure that they have the right technologies, the right products, the right people, the right environments. And once we feel comfortable, we go into the feasibility space, which we call exploration. And it may mean that we talk to them on the phone. We might do a virtual tour. If we can, we go out there and we do a one-day visit to talk to them. It's all about what you hear, what you feel, and what you see to get a better assessment if we want to go further with them. And once we do, then we go into what we call an evaluation mode. And we might bring in an auditor to look at them, one or two auditors to look at them for 2 or 3 days to make sure that we can look at documentation, we can talk to people more in detail, and then situations that need remediation, we go into the qualification phase, which might mean that we need to do some things before we can launch that product and also prior to onboarding them into GSK systems. So we have to work in harmony, not only with the scientists, like Jason alluded to. We work with project managers, we work with scientists, we work with quality groups within R&D, we work with quality group in the commercial side, and we work with quality groups in the center side to make sure that from beginning to end, we are delivering a quality product to our consumers. And so to me, I want to talk to those individuals that really are not sure if their degree falls into this, because it's all about what's possible. And in this particular area, you're looking at somebody that can not only know what the black and white is, but also work in the gray, because there's a lot of it. And so you have to be able to work not only with systems, but also with people, and combine those to make sure that we deliver a product to the market that people feel comfortable with, and it's not going to hurt them, and it's going to help them. So next slide. So again, pre-commercial activities, contractor oversight, and then central support. In terms of opportunities right now, next slide, we don't have anything. But certainly that doesn't mean, I think Kamala mentioned a lot of the engineering positions. Certainly anybody that was in those roles or that would fit those roles, if something were to come up in the business development R&D side, certainly we will look at those candidates as well, because it's something that is not really set in stone. There's no degree out there that you can get on business development. It's something that we take current knowledge, and we try to expand it into something that will help us partner with people that we can work with.
So, I gotta ask you a question or two before I let you go. But I'd love to know, for you, what makes GSK a great place to work for you personally?
Oh man, and Peter, I'm not trying to just elevate you, but I know that we had a great culture before Peter took over, but Peter took it to the next level, because I'm all about culture. And there's a saying that says that culture will eat your strategy for lunch. If you don't have the right culture, you will not have success. And to be honest, a lot of times people leave a company not because they're not good, is because of the management or the culture within that facility. And for me, Richmond, from the time that I got here 15 years ago, it has been a place where I have felt very comfortable with the people, with the activities, with everyone. I could be myself. I don't have to pretend. And I don't have to watch out for somebody's to put a knife in my back. I can always count on everybody to share their knowledge, their expertise, even when I feel uncomfortable with something that I might not know. And so to me, Richmond is that place you can actually be yourself and grow.
Excellent. Well, we really appreciate you taking the time out to present. So the next section of our evening, I want to have a brief panel discussion. So for all of the GlaxoSmithKline team, if you want to turn on your video, I'm going to ask you guys a couple of questions, and I'm going to leave a couple of minutes to see if, for all of the attendees, if you have questions, go ahead and ask your questions in the chat, and then I'll mix your questions in with some of the questions that I have for the GSK team. So without further ado, I'm going to ask you guys the first question. So feel free to speak up if you feel like you have a good answer for this question. So my first question is, do you feel that you can be yourself, culturally speaking, as a minority at GSK? That's my first question. So
That's a good question. I mean, that's a really good question. I'll take the answer. I would say yes. I don't think that there's any way to even speak around that in any other way. I mean, it's very welcome to be your whole self, as Denise alluded to, when you walk through that door. We get the support from upper management. Peter does not limit us in any way in that fashion. And I mean, us as a team, you're allowed to come in and be who you are.
And just to add on to that, we started the Minority Affairs group at the ACS, but also at GSK. Peter really took the lead and sponsored the Mosaic group. When we were at Pfizer, it was called something else, but between Peter and Kamala, those are the folks who really drove getting that at Richmond so that we would have an African-American focused group to really support people and encourage them and give them professional development.
and that actually leads to my next panel question, which is around mentoring and mentorship. So is mentoring part of the company culture there? And how can new employees connect with the mentor once they're hired?
So I can take that. So mentoring, while we don't have a formal mentoring process, mentoring is highly, suggested, right? So through our Mosaic group, we are actually formalizing a mentorship program right now, currently, in which scientists and anyone can partner with a senior leader for a period of 6 months to develop a mentorship relationship. And we hope it kind of goes two-way in a way. But we also have what's called a diverse reverse mentoring program as well, in which, and that is a formalized GSK mentoring program, right? In which actually it's reverse mentoring. So instead of you having a mentor who is more senior, you mentor the senior level person. So it's a flip on what we would think of as mentoring, but it helps really promote engagement at the senior leadership level. But it also, and then also you learn as as an entry level or as a scientist, you end up learning a little bit more about how senior leadership works as well. So that's the formalized process, but we're actually in the process of actually putting together a more traditional mentorship opportunity. But I'll tell you, I've had one ever since I've been at GSK. If you see someone you connect with and, they connect with you, there is no reason why you can't set up a mentorship opportunity right there. It doesn't have to be formal. But I've learned the most that I've learned in the building from those relationships with those mentors. And so, like with anything, it's so important that you connect with someone who can not only help you, but can hold your hand, you can bounce ideas off of. It's critical, not only in the workplace, but in life, right? So, yeah, that's my spill on mentoring. Add in as well.
No, I had a mentor before, several, and I had people come up to me and say, "Can you be my mentor?" I think that's one of the things in Richmond that is very unique, that people are usually not going to turn you down. I never heard of anybody turning anybody down that's come up to you and said, "Hey, can you be my mentor?" Because mentorship can be many different things. It could be something informal. It could be very formal. It's really up to you. It's like your development plan. Be careful what you put in there because people are going to follow up and make sure that you come through with what you say you wanted to commit to. So feel free, in Richmond, to talk to somebody if you feel that you connect with them for them to mentor you.
So I do have one question coming in from the chat that actually came from a couple of people about roles and quality assurance. It was directed towards Victor, but if there's anyone else on the panel that knows about opportunities there at the Richmond site for quality assurance roles.
Yeah, I know. So I don't know any particular roles right now in quality, because quality is so big. Not only in R&D, but also in the oversight group. We have people that work in the commercial side, also in center functions. It's not just R&D. R&D happens to be the place that they're located because they live in Richmond, but we have sites throughout the world. And for example, colleagues that work with me are in Europe. I have a colleague that works in Warren, New Jersey. But certainly, if you go into the GSK portal or you look at the website externally and you look for roles in quality assurance, be rest assured that it will be in one of those locations that you will connect somehow with somebody in Richmond, one way or another. Because other than some place in Europe, it's going to be all connected.
Excellent. So there was another question that came in about how the company has sort of responded to COVID-19. We've actually started doing these virtual events as a result of not being able to do our physical events due to COVID-19. And so one of the questions that I always ask the different companies that we work with is, how has COVID-19 impacted your business? How has it impacted sort of your day-to-day work? People are working from home. And then especially for a GSK that's in, pharmaceuticals, has the company responded to, how has the company responded to COVID-19 from a product perspective and from from an employee perspective?
Yeah, I can go ahead and take that. So I think it operates on multiple levels. So as you may be aware, GSK is actively involved in the development of a COVID-19 vaccine, and we're doing that in broad partnership as well. In the midst of COVID-19, GSK has also donated a tremendous amount of product and also dollar resources, call them dollars, and in the UK it's pounds. But at the start of the crisis, the team was mobilized and became involved very much in the community and donation of both product and financial resources. GSK as a company, though, overall, it's interesting, right? It doesn't go out waving the flag a lot about what we've done in the community, how many dollars that it's donated, which is interesting because you see a lot of companies at the start of COVID, it was like every other advertisement, they were sort of jumping out ahead to say what they were doing in the midst of COVID. So the company's been very active. On the consumer healthcare front, one of the interesting things about COVID-19, as you're very much aware, is some cases progress seriously, but the majority of cases either self-resolve or consumers are very, very uncomfortable. And one of the things that we've done specifically in consumer healthcare is to actually focus on the products to produce in our supply chain that are most critical for those that are suffering the everyday pains, fevers, symptoms of COVID-19. So emergency for immunity, Advil for pain and fever, outside the United States, Panadol, acetaminophen for pain and fever. So we've actually increased the production of that so that we would limit out of stocks and be on the shelf for consumers, because many of our products actually help consumers suffering from the symptoms of COVID-19.
Excellent response. So what I want to do is I want to leave some time for the HR team to speak to next steps, but there's a lot of questions coming in the chat. So for the folks from the GSK team, for the panelists and presenters, if you guys would like to monitor the chat to help answer some of those questions actively, I'll go ahead and continue the presentation for next steps from the HR team to speak to, if that's okay. Sound
Yeah,
good?
they've been actively monitoring the chat, so they're doing a great job with that. So go ahead.
Thank you. All right, so I'll go ahead and continue the presentation, and and hand it over to the HR team. So let me share my slides just a second here. Let me know when you can see that. Let's get down to exactly where we are. My apologies. Had to actually restart. All right, so how to apply. So the HR team is ready. Adrian?
Hello. I want to thank everybody for joining. I want to thank our panelists definitely for spending their time and giving us such great insight into the products and the ways of working at GSK Richmond. So we've gotten a lot of chatter on the chat about, different roles that we have available and where. So to let you all know, we are really focused on the Richmond site at this time. We have approximately 70 roles open across multiple lines of business that they talked about earlier. So process engineering, analytical science, formulation science. What you can do is you can go, we have a landing page for just Richmond, and you can go and see what Richmond is about and the positions that are solely at Richmond. And I will put it in the chat, but it's gskrichmondcareers.com. You can go there and see everything that's available. It is up to date, as positions close, as new ones open, it is up to date every day. If Richmond is not the location that you're looking for, then I do recommend just going to our normal career site, and you'll find other opportunities that aren't at the R&D Center. And I know we've had a lot of people on here that don't quite align with the type of work that's at the R&D Center. So definitely interested in speaking to you about other roles, and feel free to link in with me, with my recruiters that are on this call as well, that have been responding on the chat, and we will definitely help get you to the right people and get you to the right areas, because we're always looking for excellent talent. What other questions can I answer for you, Will?
No, I think that's it from a process perspective. You guys put together some great slides. So just to reiterate, for folks on the call, the landing page is gskrichmondcareers.com. What I will do is I will share the link with everyone via email, for everyone on the call and for everyone that was not able to make the call. So no worries there. And then also we have a recording of the presentation this evening. So for those of you guys that may have joined a little bit later, I will actually send out a link once we upload that to our site. But other than that, I didn't have anything else from a process perspective. If you guys have any additional questions, you can funnel those questions through me, and then I'll share those questions at once with the GSK team. But what I typically do towards the end of our presentations, I will give our keynote speaker a chance to kind of wrap things up, and any final words to the candidates. Dr. Ramsey.
Well, thank you. I've certainly enjoyed this evening. I love what I'm seeing coming through on the chat. Such a high level of engagement. I think, what you're hearing from the GSK team is a real commitment to our consumers, a real commitment to diversity, a real commitment to the community in which we operate. And I'm hoping and wish you luck as you pursue your career goals, whether or not they are at GSK or elsewhere. Certainly wish you the very best, but we hope to see you at GSK. So thank you, Will. Thank you to the entire team, Renee, the HR team, and our GSK colleagues who've joined us this evening from Richmond. You've represented us well, and thank you. I hope you have a great evening.
Yep, thank you. And we really appreciate everyone on the GSK team for taking the time out after your work hours to share your opportunities, to share your experiences with our audience. So it's really appreciated. And like I said, again, we'll share this presentation online for the folks that weren't able to make it. And for everyone that joined us, we really want to thank you for taking the time out of your evening to learn more about GSK. If it were not for folks like yourselves that take the time out to learn, about these opportunities with companies like GSK that care about diversity, we would not be able to have these types of events. So thank you. Other than that, I don't have anything else. I'll let everyone continue on with their evening, but I just wanted to say thank you.
Thank you, Will.
Thank you,
Will.
Will.
Thanks very much.
Take care.
Thank you.
Thank you, Will. Thank you, everyone. Bye-bye.
Bye-bye.
Bye.